Well, a very good evening to one and all from the communities, the doctors watching us, of course, our patient communities, for those of you who have been transplanted, for those of you on dialysis. This is a very, very special session, a topic that is not so much spoken about within the community. And of course, this is a topic on emotional well-being and mental health. And today we have with us Pragati Goyal, who is a clinical psychologist who's been practicing for the past 7 years with 1 year of expertise with mental wellness and CKD. So on to Pragati. Let's start with you.
Thank you so much, Marvin. I'm really excited and honored to be here and to be part of this conversation, and rather an important one. I think it's very important to realize and to understand the relationship between the role the mental health plays in chronic kidney disease. So I'll share my screen maybe and we'll start with the presentation. Okay. Just a moment. Yeah. Can you see my screen? Okay, great. So I have been working very closely, with people with chronic kidney disease. And one thing I realize is that, the diagnosis of chronic kidney disease completely changes their life. It affects almost every aspect of their life, be it professional, their relationship, how they see themselves, how they perceive themselves, how they even socialize. So as a result of it, definitely their mental health suffers. And before we dive into the relationship between mental health and chronic kidney disease, I think it's first important to understand what exactly is mental health. So one thing I want to specifically highlight here, that mental health is simply not absence of mental illness. I think that's how most of the people understand mental health, that someone has good mental health if they do not have any kind of mental illness, and someone has poor mental health if they have any kind of mental health condition or mental health disorders. And certainly that's not the right way to look at it. There are many chances and instances wherein a person can have poor mental health despite the fact that the person might not be going through any kind of mental illness. Let's say, for example, someone is going through some work-related stress and the person is really overwhelmed, right? Person cannot focus on the work and, is not even willing to take anyone's help. So clearly at this point of time, the person's mental health is poor, even when he's, let's say, not suffering from any kind of mental health condition. So mental health is not simply just about, absence of mental health disorders. So what exactly is mental health? So think of it this way, what are the things we want to have in our life? Maybe a sense of satisfaction from life, maybe, to have this ability to enjoy our life or to be in the present moment, to deal with the challenges, or just to be happy, calm, peaceful. And mental health is your vehicle to reach that state. So simply, mental health is about the things you do to take care of yourself. So mental health is simply the capacity of each and all of us to feel, think, and act in the ways that enhances our ability to enjoy life and to deal with the challenges we face. So I want to highlight this point that it's just not about, dealing with the challenges. It's also about enhancing our ability. So it's just not about going from -2 to +2. It's also about going from +2 to +5 maybe. So which means that mental health is something which is for everyone. It's just not for me, it's just not for you, it's just not for them. It is simply for everyone. So even if someone is not stressed out, it doesn't mean that they should not care for their mental health. They should also spend some time, caring for their mental health and mental well-being. Mental health is something which is very similar to a physical health, right? Just like exercise is not something which is recommended only to the people, who are going through a difficult, who are not physically well. For them to maintain their physical health, they regularly need to exercise to maintain that and even to enhance that. That's how similarly mental health works. And I think if we have that understanding, we will break the stigma around mental health and we will start, giving it the importance I think which is required here. So let's try to understand the relationship between mental health and chronic kidney disease. To do that, I think first we need to address two important questions. Can kidney disease affect mental health? And can mental health affect kidney disease? Definitely, the answer is true that both of them are going to affect each other. It's a bi-directional relationship. Your physical health is going to affect your mental health, and your mental health is going to affect your physical health. It's important that we realize this connection between our mind and body, right? They work parallelly. They're completely connected. If physically we're not feeling well, that's definitely going to affect how you feel emotionally. So that's why it's even more important that if you're going through any kind of chronic condition, it's important that you start paying attention to your mental health, especially in the case of chronic kidney disease. As we know, it's a lifelong condition, and there are many challenges which keep coming up at each and every stage. Maybe during the diagnosis of the illness, during the treatment phase, when you're starting dialysis, when you're thinking of transplant. So it is a part of it's going to be a challenge at each and every stage. And in fact, with chronic kidney disease, there are a lot of challenges which comes up, right? There are a lot of dietary restrictions, there are a lot of lifestyle changes. And in fact, there are a lot of psychological changes you have to deal with. There's almost this loss of sense of control over your life. And this loss of sense of control over your life, take away that sense of stability from your life. And if you don't feel that you're stable in your life, you can't focus on any other thing. Again, there's grief. There's this grief process going on around, right? There's grief for lost status of your health. There's grief for lost abilities, for not being able to participate, maybe in the things how you were participating earlier. There's this big change in your role and identity. Sometimes, going from being independent to dependent. And especially for males, that's a very big struggle. So in fact, there are a lot of studies done on this. And now we know that, depression is up to 3 times more prevalent, which is definitely a big number. In fact, about 23 to 29% of people with chronic kidney disease can experience depressive symptoms. And in fact, surprisingly, studies, which are done in India, with Indian population. Now, these studies show that about 66% of people are affected by chronic kidney disease, which is almost a double, of the number of what we know, studies have shown in the Western countries. So the number is rather alarming, and in fact points to the importance of that we need to pay attention to our mental health, and especially for the people who are going through chronic kidney disease. And again, it's just not, coping up with the challenges which will come with chronic kidney disease. Also, some of the mental health issues people experience can also be a result of their physical change because of, kidney failure, such as anemia. Anemia can definitely make you more prone to experiencing anxiety and depressive symptoms. Again, the buildup of waste products in your blood can cause change in your mood and cognitive function. A lot of people report, mood swings, this kind of constant irritability they experience, fogginess, and memory loss and confusion, which can again happen due to buildup of waste in your blood. Again, because of this, you might also experience problem in sleep. And because of problem in sleep, you might experience additional difficulties like fatigue, low on energy, depression, and anxiety issues. But as I said, that depression is very common with people with chronic kidney disease, but unfortunately, most of the time it's not even recognized. One of the reasons why it is not recognized is because some of the physical symptoms of depression and anxiety, like feeling tired, fatigued, or poor appetite, maybe similar to those caused by CKD or its treatment. So a lot of people, when they experience these symptoms, they disregard it as something which is happening because of CKD. So they do not even pay much importance to it. And another problem is that sometimes we might disregard how we feel because we think that intense sadness or worry is simply to be expected, which is not true. Even though when I said the number is big, it's about 60% of people experience depressive symptoms, still about 40 to 50% of people do not experience these symptoms. So if you are experiencing any of these symptoms, if you are experiencing any kind of pervasive sadness or persistent low energy and not being able to participate in anything, I think it's important that we don't ignore it. At least we talk about it with someone, with our family members, with our nephrologist, with our treating doctor. I think especially we come from a culture wherein it's not normal for us to talk about how we're feeling. So for a lot of people, it's a challenge in itself to describe, what they're feeling. So to describe the symptoms of depression or anxiety may be very hard for them. So again, this is one of the reasons, why a lot of time it is missed, and we do not recognize people who are going through this phase. And mental health can also affect your kidney disease. And in fact, it's very important to understand that. See, if I have good mental health, I'm more likely to take, decisions which maybe, which will enhance my physical health as well. When I'm not mentally feeling well, it will definitely, bring difficulties in, taking good decisions. I might indulge in activities which might directly affect my kidney disease. In fact, there's a very interesting study, which shows that just if you, perceive your illness negatively, just having the negative illness perception can affect the progression of disease. So just by, kind of considering your illness as something which limits you, or if you see it negatively, it affects the progression. So, your illness might worsen over time period. In fact, there are a lot of studies, which show that depressive symptoms in CKD are a predictor of adverse outcome, hospitalization. In fact, they increase the risk of mortality. And in fact, this link is even more stronger in men than women. So I think it's important that we understand, how mental health can affect your kidney disease too. And these are some of the things you can do to take care of yourself. I think the first important thing is to understand, it's okay to ask for help. And to ask for help, it means that you can also take help from anyone. You can also talk to your family members. You can talk to your nephrologist about how you have been feeling. And that's a very important step to move toward, the things we can do to take care of ourselves. Again, another important point is don't cut yourself off. I think this is something which happens very commonly with a lot of people when they go through such a chronic, life condition, health condition. They generally cut themselves from people around. They think that now nobody is going to understand them. So they isolate themselves. If you're going to isolate yourself, it will be even rather more difficult to deal with the things. In fact, one of the important predictor for good mental health is how well you're connected. So it is important that we learn to stay connected and we don't isolate ourselves. Again, another very important point is that give yourself permission to slow down. I think it's very necessary. In this fast-paced world, it's very easy for us to, to get caught in that loop of criticizing yourself that I'm not doing well, or I need to do better. But I think it's important you realize that if you're not, feeling well on a particular day, slow down, right? Think of it this way, let's say if your friend was in a similar situation, what are you going to advise that person? Are you going to advise that person to, keep criticizing yourself or to take a break, right? I think a lot of time it's easier for us to be compassionate toward other people rather than toward ourselves. So it's very important to be kind and to be compassionate toward yourself. Again, it's very important that you work toward acceptance. Acceptance is going to be a lifelong journey. It's not about not feeling pain. It's rather about changing your relationship with your pain. So which means that you can sit with your pain, not run away from it. And yes, it will take some effort, it will take some time. And as I said, it's a lifelong journey. It's very important at the same point of time that we participate in the activity which bring pleasure in our life. A lot of people disconnect with themselves from the things, which naturally make them happy. And that's another reason, why they are more vulnerable to experience the depressive symptoms or the anxiety symptoms. So it's important to recognize the change in the life which they are experiencing. If they notice that, there's a change which is coming along, they're not participating in the things as they were earlier, it should be a sign for that they should push themselves to do the things, which naturally, make them experience that sense of pleasure. Again, embracing uncertainty is very important. Uncertainty is part of everyone's life. It's just after the diagnosis of such a condition, it is more obvious. You realize the presence of it at each and every step of your life. And I think uncertainty is something, at the same point of time, it's a beautiful thing also in your life, right? Uncertainty adds the possibility of multiple things can happen in your life. And that's only possible when you realize that life is little uncertain. So don't chase after the things you can't control. Focus on the things which you can control. Again, understanding is your power. And to get that control over your life, it's important to have the right knowledge about the illness, about the course of it. So whatever information you can gather from your nephrologist, you keep a list of the questions you want to ask from your doctor. And whenever you visit your doctor, make sure that you ask those questions. I mentioned this point earlier as well, that be kind toward yourself. It's very important to do that. Start your day maybe on a note of affirmation. Keep a gratitude journal. Something very easy you can do is keep your right hand toward the left side of your chest. When you press your hand this way, there's a hormone which is released in your body, which is called oxytocin. It naturally makes you feel loved and safe. And I think it's a great way to start your morning, right? Wish yourself good morning. It might feel a little stupid and silly, but I think it will bring a smile on your face. That's also completely fine. Recognize the warning signs. If you notice that you're not, sleeping a lot, your appetite has changed, you're feeling this persistent and pervasive kind of sadness, don't ignore it. Talk about it to your doctor. Right. And last, learn some relaxation exercises. It can be a very simple breathing exercise. It can be any kind of meditation you do. It can be just any sort of physical exercise too. So that should also be part of your daily routine. So yeah, so this is about us. So we are actually, I work with a company called Listen, which is a tech-enabled company, and we try to provide all the kind of mental health services to the people, going through chronic kidney disease. And we have partnered with NephroPlus to provide mental and emotional wellness, and we are offering one complimentary session to every patient with chronic kidney disease, and they can use this code NephroFast to book a session. And to book the session, you can visit our site, and you can also contact our support team. Yeah.
First of all, thank you, Pragati. I think such a heavy topic broken down very simply so that the common man could understand. Maybe we'll stop sharing our screen so that I could see you on a larger place. Yeah, thank you. And you touch upon a very, very important point on culture, right? Because the culture that we come from does not allow us, I think globally itself, mental health is considered as a topic of taboo. If you say mental health, it means a sign of weakness. But then, like you said, anybody could just go through mental health. But in a case of a CKD patient, because their uncertainties are more than a common man, probably they need to be more mentally strong to face their challenges, right? They need to be more stronger than a common man itself. But there's one point that if you can you touch upon is, the mental health for the men in our country, because over here, there's so much of pressure of being the male gender where they're not used to exploring or showing off their emotions. So when a man is going through a mental health, at least we women are used to talking about our issues. But when it comes to a man, the man is not used to talking about his issues because then socially it is not something that a man does. We are conditioned not to talk about it. It's a sign of weakness. So in your experience, can you talk about why men should actually take a closer look at what they feel and be connected to their emotions and look up the first signs before they reach the point where they go through chronic depression, and then they need to even seek anti-anxiety pills and etc. And why addressing an issue like this early would actually help them?
Right. Thank you, madam. I think that's a great question, and that's something you have beautifully touched upon. That especially for male in India, I think still it's a big taboo to talk to someone, to take help from someone, and partly, it is there because of how we are socialized, how we are brought up, right? Since our childhood, this normalize that it's okay if if you're not feeling well, right? You can go to a doctor, you can talk to a doctor. But the moment when you start talking about your emotion, that is fixed, that is corrected, right? Oh, you're not supposed to feel this way, right? And I think one of the common thing and most stupid thing we can talk about is, men do not cry. So that's the idea, most of the males are brought up with, right? That it's not okay to feel emotionally well, right? There's a lot of shame attached with that idea that if you're going to someone, if you're talking to someone about your health, right? Especially with males. And, that's again, one of the barriers which stops them, from seeking the help. And as in we talked about that, mental health is something especially more important in the cases of chronic kidney disease because it's a lifelong condition. There are going to be multiple challenges. And at the end of the day, it's important that we honor the fact that we are just humans, right? We're not superhumans. We can feel weak, my mental health status can constantly change. I can, feel not okay at times. And it is rather even more important because mentally, if you're not feeling well, that's also going to affect your kidney disease. There are more chances of hospitalization. There are more chances of indulging in reckless behavior when mentally you're not feeling well, right? Mentally, when we are not feeling well, one of the things which we look out for, and especially males I have seen, is that they kind of look for escape, right? Maybe escape through binge eating at times, or maybe just drinking something, right? Or just kind of escaping through just taking a smoke, or just find an escape for wherein you cannot wherein you try to not sit with your emotions. And that in itself is a kind of a vicious loop, right? Even if you try to escape from your emotions, right, you will be able to do that maybe for best for some moments or some hours. Then again you will be stuck with that feeling, and then you're kind of left with this feeling of helplessness that you don't know how to kind of fix it. So I think it's even more important to realize that, if you start learning to take care of your mental health, you're just not taking care of your mental health, you're actually taking care of your physical health. So health is something which is, we can't separate it into, this one thing separate as physical health and something separate as mental health. I think both are connected. And so I'll tell you one case, I was working with, so wherein this person was going through chronic kidney disease for about last 10 or 12 years. And, he has been working since then. He has been taking care of his family since then. But because of, he has been doing all the things, his colleagues and his friends see him as kind of like a Superman, Iron Man. They literally call him Iron Man. And because of that idea and that identity he has to carry around, that, see, I'm a Superman, I'm an Iron Man, he faces a lot of difficulty in, talking to his friends about, any emotional challenge he's going through. So I think we need to normalize the idea of that, there are no Superman and Iron Man, and even Iron Man and Superman, they can feel low at times.
Actually, thanks for bringing up that point, because my journey to mental health opened up just like the man you spoke about. So I was called the Iron Lady because of being a caregiver, bringing up 2 children. My husband had 2 transplants. He had 2 open heart surgeries. And through it all, I was working, the breadwinner of the family. So everybody used to look at me at this epitome of strength, of an ideal woman in my vicinity, at least. But subconsciously, that became an identity for me to live up with. And I never realized that I was working on an auto mode throughout. And anything could actually come to me, and I could face it. Unless I came to a point where life came to normal and my husband's health settled down, and then my nervous system crashed. I had a panic attack, and then is when my introduction to mental health came in. And what was the most difficult thing that I went through, Pragati, is when the first one to diagnose that I had a mental health problem was me. And I knew I was hitting mental health because I was staying quiet. I was always tired. I felt like binge eating. I didn't want to interact with much people. And the one thing when I went to people and I was telling the near and dear ones that I'm not feeling good. I'm losing. I'm feeling low. They said it cannot happen to you. Come on, you've seen so much. It's all right. So the society itself plays a huge role in us having to accept that we could hit a point of lowness. We could hit a point of not being able to help ourselves, and society does not come to support you because they think that you have seen it all, It's okay for you to think you cannot face it, but it doesn't mean that you can't do it. And I used to tell people, I can't do this anymore. And it became difficult for people to accept. So that point that you brought up, right? Because for us, every member in the community is a warrior. Every story is inspiring. They're just so used to facing their challenges with courage that they are not allowed to take a break and say, I do not want this anymore. But it's okay not to be okay, like you said. It's okay to say, I don't want this disease. It doesn't mean that it's going to go away, but it's okay to say that I'm just fed up of this and talk about it. And the reason I'm placing myself as a vulnerable person is because I think caregivers itself go through this so much. And I talk about my weakness to caregivers. I need a counselor. I have a mental health professional who I go and talk to because I just hold so many spaces for other people, and caregivers come and talk to me. And sometimes I feel I need a space to go and talk about it. But people think that going and meeting a person who's a specialist is a sign of weakness. And they also don't think it's important to invest their money in that space. But I think if I have personally grown in my journey as a caregiver is because I went and I met a professional and I spoke about how I feel. And that gave me the ability to see beyond this role as a caregiver. Beyond the work that I do, I was able to see what this role could offer me as an individual. So I call this capsule as beyond the role of caregiving, what all you can see about yourself that otherwise you'd never been able to see. That's what exactly you mentioned. When uncertainties come, you're able to see beyond what you can normally see.
Yeah, definitely. And I think that's a beautiful way to put it, right? Beyond caregiving, right? And as I said, mental health is just not about, correcting things or fixing things. It's also about enhancing your sense of well-being. And that's very important to understand. I don't think, that most of us relate with an idea of mental health this way, right? We see it as a sign of weakness. We see it as a sign of lack. But I think mental health can be a journey of discovery, right? It can be a journey of knowing yourself better. And I think all of us are on that journey in some way. We just don't realize that. So I think mental health is just a word we have started using since past few decades, but it has always been there. And, I think surprisingly, we come from a culture, a very rich culture wherein we have Upanishad, Vedas, scriptures talking about mental health, right? Every Upanishad Vedas has talked about, achieving a higher sense of well-being. And still, when it comes to us, we immediately get scared, right? Like, talking to someone is something such an alien idea, but it has been always an idea within our culture. I think something we lost with time. So, yeah.
So that takes me to my next question is, you already mentioned that why mental health is important in CKD because it's a lifelong disease. Your challenges are more, your uncertainties are more. So you need to be even more stronger as a human. What are, in your journey, since you specialize in mental health for CKD patients, in your journey, what are the common mistakes you feel people have done and they've not caught the early signs, and what is the right way to look at it? I'm specializing only to CKD over here.
Right.
If you want to break it up with dialysis and transplant patients, you can break it up, or even caregivers. But if you can tell us the common mistakes that people make.
Right. I think one of the common mistake which I generally see is that a lot of time, so see, mental health has a manifestation physically, emotionally, and behaviorally, right? It is going to affect you at each and every level. Usually the first manifestation is at physical level. Physically, you will feel that change. But a lot of people with CKD, they disregard that change as something which might be happening just because of CKD. If they are feeling tired, if they are feeling, let's say, anxious, because anxiousness has a very prominent physical presence, they might feel the racing heartbeat, or breathlessness, or just dizziness. They might just disregard it as a symptom of CKD, right? In fact, one of the first things which gets affected is sleep. And again, a lot of people, since they also struggle, in sleep because of CKD, they disregard it as if something is only happening because of this illness. So one of the important thing to take care of is that physically, if you notice any change is there, don't disregard it. At least talk to your treating doctor. That's very important. Secondly, I think with regard to, especially if I talk about dialysis, I think there's a lot of guilt a lot of people carry at times that, they are burdening their caregivers. And at that point of time, they stop sharing and talking to their family members about how they're feeling because they don't want to burden them further, right? This again creates this barrier. This again make them feel, more isolated in this journey. So another important point is that whenever it's okay, I can understand that a lot of times you might feel that guilt, but it is okay to talk to your family members about, how you're feeling. Because a lot of times what we do is we assume what the other person is feeling. And obviously none of us is a mind reader. We need to understand how the other person is feeling. And, with, again, especially after or before the transplant, before the transplant, a lot of people, again, they kind of, get in this dilemma of, that we know that it's an uncertain journey, right? We don't know that what is going to happen. And just because of the fact that you are not able to deal with that uncertainty, a lot of people take the decision not to go ahead with it because they feel that, if it's not going to work, then maybe, I should not take that step. But I think it's important to realize at that point of time that, uncertainty is going to be part of their journey throughout, no matter what decision they take. So it's important to learn to live with the uncertainty. And something with caregivers, as you also pointed out, right, that, taking the role of caretaker, right, there's a lot of changes which comes around, right? You try to see, try to adapt to a role of wherein you need to see yourself as someone that who's strong, who can always take care of all the things. That idea in itself, builds a lot of barriers around, right? You will keep stretching yourself to a point wherein you can't stretch yourself more. So it's important, and in fact, I think we should make it a habit, right? On daily basis, maybe, just once in a week, just ask yourself how you're feeling. I think it's very important. And in fact, I generally recommend do it daily. Just, take a moment, take a pause, and just check with yourself how you're feeling, right? Don't ignore it. I think it's equally important that you learn to take care of yourself. That's the best way to be compassionate toward yourself.
Thank you for that. Two very, very important points that it's so important, especially when you spoke about the guilt of the patient and where they isolate themselves. I think it's a story of every house, literally, for a CKD patient, because I think that especially houses that have men who are on the disease, they kind of feel guilty over a point of time because they feel they can't do this anymore. And also for women on this disease, right? Men feel that, oh, I have to be there. There's no choice for us, but we have to be there. And they sometimes find it difficult to process emotions because I think women, because of our hormone, we just process emotions. We think in emotions. Men find it, and the conditioning for men not to process emotions when they see their women breaking down. If the woman is a patient, the man caregiver cannot deal with it. And then he deals with so much of guilt that he's able to know what to do. And then he goes out and then he talks to other women and kind of finds his space to talk about it. But I think going out and speaking to a mental specialist will make the process much more easier and less complicated, because I also feel that, I don't know if it's the right forum to say this, but by men going and talking out and find that emotional support outside, it leads to even more complicated situations of having emotional relationships with other women, which complicate the primary relationship between the patient and the caregiver. And trust me, this is a very common point. So I'm actually bringing it out on a public forum. And that's where I think a mental a specialist plays a huge role, because they're able to hold that safe space of letting their client process their emotions and bring them out to beautiful realizations. right? So moving on to the next point where we talk about transplant patients, right? So when a person goes through a transplant, there's always mixed feelings, but when they are on the journey of transplant, there's a sense of relief because they're close to normal life. Now they have 7 days in a week. Initially, they had only 4 days or 3 days in a week, but now they have 7 days in a week. And as they go through the journey of transplant, many of the patients forget they're transplanted patients also. And they just start living normal life, which in a certain way is good also. But a constant reminder is also important because once you're a transplant patient, you're already always a transplant patient. But then let's talk about this point, which somebody also mentioned as a live question of the immunosuppressant drugs. Now, the immunosuppressant drugs play a whole lot of difference in the role that you could feel emotionally and mentally. I know, like my husband could sit and watch a movie and he would cry without even his knowledge. And he will just tell me, it's not me, it's prednisolone crying. So the fact that he actually has to constantly remind me, please forgive me for bringing up this point, but he'll be happy that I actually did. The fact that he actually brings up this point is because he feels it's not okay to cry. It's not, he has to remind me it's the steroids that is making him cry. And sometimes when I cry, he says, are you around your periods? Is it your hormones? Are you aware that you're crying? And I'll tell him, I'm very well aware, processing this emotion because it's a beautiful emotion and I'm processing it and I'm crying. So the point that he brings up, that it's the steroids, no, I do not know whether it's actually the steroids or it's him processing the emotion. And both of it is okay. It's okay for you to process the emotion. It's okay for you to see the movie and cry. It's okay for the steroids to let you process the emotion, whatever's happening in your body. But transplant patients do go through a lot of mood swings. So I like to touch upon this point, and I also like to further touch upon, as a woman, we all go through our hormonal phases of our periods, right? And we've taken it for granted that, oh, you have your periods, you're going through, oh, you're PMSing. So it's okay for you to feel low or throw a outburst. But now, a woman who's transplanted on immunosuppressant drugs and then also has this huge hormonal imbalance that's happening during her periods, it's extremely difficult because we see a lot of women coming up. They feel like they're having multi-personality disorders, especially women who are very aware of what is happening to them. It becomes even more difficult for women in this case. So you see how men are processing this and how women are processing this. So can you touch upon this for our transplanted patients, and when should they seek help, and it's whether it's okay for them to process these hormones or just give, I mean, it's a very new subject to me, actually.
Right. So I think it's rather important to understand that after the transplant, it's very important that everyone should, be counseled by a mental health practitioner to understand, one, what is mood swing and how to respond to mood swings, right? As in you said, even though when people have this understanding, that this must be happening because of the drug, right? They are kind of, talking about it as if it's a justification, right? See, I'm experiencing this, but it is justified because, I'm on some drugs, right? So still the idea is that it's not okay to experience emotions, right? So I think the first important thing is to, not just, I think, for them, but for everyone, to educate ourselves about our emotions. Our emotions are very important. Our emotions are the guiding force in our life. And this is one of the reasons, why we have survived as a species, is just because of emotions. So, the thing is that we think that we are thinking machine, which can feel, but we are feeling machine, which can think. So it's very important to understand that idea and to talk about that idea. So that's why, after the transplant, I think it's important for, especially for, I'm just not talking about males or females, but for everyone to, have sessions with mental health practitioners about what they are feeling, how often they are feeling that emotion, how they can respond to that emotion in a better way. Right. Again, when you said that, when you gave that example, when your husband experiences that mood swing, right, he's immediately kind of, telling you that, he is on this drug and because of this, he's experiencing this, right? Again, that also happens partially because of we do not realize that how other people are going to respond around us. So we make it a point to, clarify, to justify. See, this is happening because of this. Don't get uncomfortable. Right. So I think it's a journey wherein, It should involve the patient, it should involve, family members in terms of how they can also better respond to these mood swings. And as in you said, for the female, there's an added layer, right? There's hormonal changes, before the periods, and they again experience multiple things at the same point of time. And to deal with that, kind of feels like, it's a task. But at the same point of time, we disregard it, right? That, oh, it's okay, it will happen, right? So, you don't pay attention to it. The problem with normalizing things is sometimes we normalize in a way that we stop paying attention to it. So it's very important to realize that, at the same point of time, if you're experiencing something, if you're not feeling okay, yes, you should kind of pay attention to it. You should accept it, and you should take help at that point of time. How you can take help at that point of time is, one, let's just try to understand what are emotions, right? Emotion is kind of like this energy you experience in your body, right? You can always locate and you can feel your emotion in your body. So one of the best way to deal with your emotions is with the help of your body. So one of the technique you can practice, this is for everyone, to deal with the emotions, right? Just, close your eyes whenever you're feeling emotionally overwhelmed, right? Kind of imagine like you're scanning your body, right? And just locate, if you can locate that emotion in any particular part of your body, right? And just locate it down there, right? And take some deep breaths. And when you take deep breaths, imagine the breath, kind of rushing to that part of your body and soothing that part. And when you're breathing out, you are relaxing yourself. Now, this is a combination of imaginary techniques and some relaxation techniques, but it's a very powerful technique. And in fact, one of the powerful techniques to deal with the emotion, simply label the emotion, what you're feeling. A lot of time we are confused to as if what we're experiencing because we can experience multiple things at the same point of time, and that builds up the confusion that is something wrong with me. I can't understand what is happening with me. So one of the easiest thing we can do is just label what you are experiencing. And a lot of time we don't need to do things. What happens when we experience emotion is we get restless because we need to do something about it, right? I need to distract myself, I need to run away from the emotion, I need to escape from the emotion. But a lot of time you don't need to do anything. Emotion is like this wave, it rises and it falls, but we just don't let it fall. Sometimes you just don't need to do anything, you just need to be with that emotion. And we have this, I can understand, but we have this aversion to towards certain emotions, that, oh, I'm again feeling this emotion, I'm again feeling irritation, I'm again feeling sadness, I'm again feeling anger, and that intensifies your emotion. So it's important to build this acceptance toward all the kind of emotions. The more you build acceptance and you welcome these emotions, you will feel these emotions in a very different way. So dealing with the emotions is just about changing your relationship with emotion. It's not about not experiencing these emotions. So I think this kind of educational sessions should be there for people with transplant, and not just for them. I think for everyone, it's very important. It's very important. Yeah.
So this point that you made is very, very interesting, because in 2019 is when I started this technique of leaning into my emotions. Of course, that time I didn't really have the knowledge on mental health, but I was so gone in my life that I had no choice but to deal with life, right? And so whenever I felt something, I would just, if I felt pain, or I felt hurt, or I felt fear, I would just sit down and sense the emotion in my body, and would sense and then I became familiar with emotions, right? So when an emotion came to me, I knew what emotion it was, because we are not familiar with different emotions. We only know happiness, sadness, anger, fear. But I became very familiar with emotions, and because I became very familiar with emotions, soon as an emotion hits me, I was able to say, oh, this is the emotion I'm processing right now. I became so familiar with it. And the best example I give people is, when you break up the first time, when you have a heartbreak the first time, you feel your whole life is fallen apart and then there's no more scope in life. But when you break up with your boyfriend or your girlfriend for the 10th or the 20th time, you know that life moves on, right? So when you become familiar with emotions, I think that's what happens. You know that you're on a high, but eventually it will settle down. So do not run, like you said, don't run away from your emotions, stay with your emotions, because you're giving the body the intelligence, or the nervous system the intelligence to say that, okay, now I'm a high, I'm really bad with this emotion, and this is how it's messing with me, but eventually it will go down. So staying with emotions, the beautiful point that you made. But of course, for those of you who are very new to the subject, you might find it scary to stay with the emotion, but definitely it is safe for somebody who's practiced it and come out. And of course, an expert who's sitting down there and saying, stay with your emotions. I think the best way to start is seeing a specialist and learning to practice all this, because they would create that safe space for you to process everything that you feel from within. Because on that note, I think we have come to the end of this session. And I think it's a very, very beautiful session for people who found this even overwhelming to hear. I just need to tell you that from somebody who has been through problems of mental health, but let me tell you that that part of me recognizing my mental health issues was a turning point in my life to make me who I am today, more stronger than ever, because I came to realize it's okay to be low, it's okay to hit a breaking point. It is not the end of the world. You will rise back again. And every time I hit my lowness, I was only able to come up back stronger, because I was able to embrace my vulnerabilities, my weakness, and it made me a much more beautiful, stronger woman. So it is okay to feel the way you feel. It is not a sign of weakness. It is a strength to recognize that you need help. It is a strength to recognize that you love yourself and you need to seek help for your emotional and mental well-being. It's a service done to people around you. It is a huge help done to people around you when you recognize this. So please seek help. Uh, and this is not a one-time help. Keep seeking help constantly, because if you want to be a patient who handles your disease way better, if you want to be a caregiver who can love your patient or the loved one way better, seek mental health practitioners. Even if you feel you don't need it now, trust me, we all need this space, because we are on this journey of uncertainty. It will make you be aware of yourself much better, and you will actually have a much more beautiful journey. Me and my husband share this beautiful space of talking about our pain, talking about our vulnerabilities. I can look at him and say, you know what, I don't want to do this right now. And he will look at me and say, you know what, it's okay, take a break. Just take a break. It's all right. And I think it's so healthy for patients, and especially in relationships, to have this conversation of saying, I cannot and I don't know what to do. So, I mean, I can go on with this topic, but in a nutshell, I think that safe space of going and meeting a specialist is the most beautiful decision I've taken for myself. And I think it's really helped me. So please make this choice for yourselves, because this is the best decision you could take on the journey of CKD. And before we close the session, I would like Pragati to share that slide once again on the first the offer that is going on. Will be
Right. Yeah, sure.
that slide. We will also put up the slide on our WhatsApp group, on our Facebook pages, so that you can take on the offer, and you can reach out to our specialist, which is the Listen psychology group of psychologists, and go on for a free session. See how you feel in your free session. It is a free session. Give yourself the chance to go and get some love. Don't stop yourself, and then you'll know the difference it could make. And yes, Vasundhara, myself, Anjali is there. We're all there who kind of believe in this importance of mental health. You can call us, you can talk to us, and then we will tell you why you have to go and take up this free session also. So I think that brings us to the end of our session. Thank you very much, Pragati, for being so warm and sharing the space on a topic that I love so much. And letting me host this session. And I hope that your love for the community, your vision to make life easy for CKD patients actually comes to life with the Kidney Warrior Foundation, because I think our patients need that love, our caregivers need that love. And I think as a community, we all need that love. So once again, on behalf of the Kidney Warrior Foundation, thank you very much for joining us today and taking us through the session. because this is the end of our session, and this is me signing off, wishing you all a very good evening, and a special thanks to Pragati once again. You want to sign off with something, Pragati?
Yeah, thank you so much, Martin, for this wonderful session. I think, okay, I think record. I think the recording, yeah.
That's okay.
Yeah, so just thank you so much for having me here. It was wonderful, to be part of this conversation. And I think it's there's some great work you are doing. I think it's very important to spread this awareness about mental health and to talk about it, even more often on such platforms. I think this gives a space to people, to relate with, to understand. And I think something, coming from, people who are going through this, I think it, in fact, helps them to relate with this topic in a better way. So yeah, thank you so much.
Thank you. And yeah, we'll get back to you soon. Thank you, Pragati.
Yeah, sure. Bye. So I can share my slide if you want.
Pragati, can you send us the PPT and then we'll put it up on the
Yeah, I'll share my slides with you. Yeah.
Thank you. Bye.
Okay, bye.